I'm Dr. Pamela Alberto. I'm a clinical associate professor at New Jersey Dental School in the Department of Oral Maxillofacial Surgery. I've come here this week to provide for a second time dental care for the people of Restauración. We treated easily over 300 patients. I found that this year the dental disease was actually more severe than I had seen last year. Because of last year's trip, the word got out more to the communities outside. So I found that a lot of the individuals that were coming to the clinic this year were coming from hours away. Usually when people were willing to come an hour or two away from where they live, it's because they really have acute problems and they're desperate and they'll go anywhere to seek care.
Sí, nosotros te vamos a dar una cosa también para que se pueda limpiar entre cada diente. ¿Ok? Hay instrucciones ahí para usar.
Me llamo Juan Miguel, tengo 11 años.
You know what we can do with him is actually we should take an x-ray and see if that molar is, savable. If it's not savable, then we'll extract it.
Vine a aprovechar el operativo médico.
I came to take advantage of the medical mission. My son has serious dental issues. The cold weather affects his teeth and it gets him in such pain that he's not able to eat comfortably. Last year, it was difficult because of transportation problems. This delayed us, and by the time we arrived, it was too crowded. I am not discontent by this, since doctors wanted to give every patient the same attention and care. Everyone feels secure by the quality of the doctors and will like to enjoy the services that this mission offers. And that is why we arrived early today.
Mi nombre es Melian María Guzmán Cabrera.
My name is Mariana Cabrera. I am 20 years old. I am from Guaya, Jayuco. I thank God because He allowed me to meet people with such beautiful hearts like you. To come here to the frontier where there are so many kids with dental issues. We don't have dental services in this community and we have no choice but to go to the city, and sometimes the services are too expensive. And that is why some kids do not have the economical possibility to receive the dental services. Therefore, their teeth get damaged.
The overall health is poor because there's no preventative care here. First of all, most of the children don't have toothbrushes. That was one of our goals last year and this year. Last year we brought 400 toothbrushes. This year we brought about 600 toothbrushes and toothpaste. So it's hard to take care of teeth when you don't have a toothbrush, when a toothbrush is a luxury. The other is that there's no fluoridation in the water, so they're not protected in that way, and most of the young children never got any sealants. So one of our goals is trying to instill some prevention. So we pro-feed and place fluoride varnish in as many children and provide sealants to as many children as we can, hoping that the more we come and the more we do that, we'll start seeing a reduction in the dental caries rate here.
I'm Jan Tracy. I'm a professor at William Patterson in the nursing department, and I'm also a member of the Community Church of Smoke Rise. The mission has a few different parts. First of all is to serve the neediest people who don't have any dental care here. Over the course of the last 2 years, we've become much more efficient. We've been able to anticipate the needs and set up ahead of time. This year there was a lot of pre-planning by the local people so that we were sure that we saw the people that were most needy. And we've been able to work on our triage area so that the people are appropriately treated But a big component of it is education. So we've been teaching them how to brush. We've been giving them the tools to do that. And we brought some first aid kits this year. We brought a lot of hand sanitizer. We recognize that people here don't wear sunglasses even though the sun is very bright. So we brought those kind of items with us to distribute to the people. So we're looking from a holistic perspective of the many things that we can do for the people while we're here. And among those, of course, is the dental is what brings them in. And then once they're here, we're able to teach them about the sun, about their eyes, and about different parts of their health beyond dental caries.
Mi nombre es Willy. Tengo 24 años.
My name is Willie, and I am 24 years old. I was born in Haiti. In my country, we do not have water or electricity, which makes it hard to keep ourselves healthy. The doctors do not do a good job. They do not know how to remove the teeth properly, which is why I came to this hospital. I am satisfied with the way doctors work through this mission and thankful to you for helping me take care of my dental problems.
But right now, if we fill that front tooth, we'll save it for him, which is huge. Okay, so what we'll do for him right now is let him get a prophy, okay, and no fluoride. Let the girls fill the tooth first, and then they can do the fluoride. All right, and then next year he comes back, and we can see about doing some other things. And he'll be happy because he smiles and there's no hole.
On this trip, we've brought 6 students. 3 are nursing students and 3 are dental students. And a large part of the trip is educational for them as well as for the patients here. It fits in for part of their community service, and it really has been many, many lessons that we wouldn't have anticipated. The students have learned interdisciplinary teamwork, which we believe is very important to become part of the larger community of healthcare professionals, and we see a real confidence boost from the beginning of the mission to the end of the mission in terms of the students' ability to be autonomous and work together and see the greater good, not just the one little spot that they've been trained to look at.
What do you think? There, just put the bands.
Put infiltrate into that, okay? And then
Mi nombre es Sonia, vengo de Loma de Cabrera.
My name is Tonia. I am from Loma de Cabrera and I'm 32 years old. I'm very grateful to you for doing this mission. There are so many people who do not have the financial resources to receive the dental services. Therefore, we are grateful for your effort. Before I received the treatment last year, I had a lot of cavities and it was impossible to even laugh because of the great deal of pain it caused me. After the job from the dentist got done, I was really happy because I could laugh again.
what I'm hoping is we've started to foster a relationship. And this year I came and I actually provided a continuing education course on how to treat complicated extractions and how to manage complications. And I think the local dentists were very happy to have this service because they really don't get continuing dental education where they are. And actually we did have one that came and worked by my side, and I actually helped her, teaching her some extraction techniques. And the extractions here are hard. They're really procedures that in the United States specialists would do. So to expect the local dentist to be able to overcome these challenges, it's tough.
Sí, ha sido muy beneficiosa y a la larga.
This mission provides numerous benefits and also helps people to get educated in dental hygiene. It means a lot to me. It satisfied me as the director of the medical center. It is really nice to see you again, to be in contact with you, and I hope you were well treated. I also hope you are satisfied and that the physical space we provided meet your needs. I wish that next time things are in better conditions. We are really thankful to you since the medical mission accomplished its goal for everyone, especially kids.
What I'd like to see is this become at least a yearly um, trip, a yearly mission where we come once a year and we provide this care, and every year we can see how much better things are getting. And if we foster relationships with the dentists, the other dentists can also work with us as a partnership. And I think that over time we will see improvement. And if we keep sealing and fluoride varnishing and brushing teeth, we'll get to the point where we come here where we can provide comprehensive care, where we'll actually come and, maybe start doing root canals here and start doing other procedures than just doing more of the acute procedures. So I look at this as a prevention mission also to improve the dental health in these kids.
We've come to appreciate so many different things in life. This trip helps to make me grounded. I have suddenly realized what you can do with a half a bucket of water and how far that can go with a shower or with cleaning instruments. We value the things here in such a different way that it is really a treasure to be able to see the simple things in life and to realize that these people are very happy. And although they don't have what we would consider material possessions, they have wonderful hearts. They are very appreciative. Every single person who gets out of the chair is gracias. Thank you so much. And, we love you.
We thank you very much. I don't have sorrow. I can do nothing to pay why you are looking, while you are doing here. We can find money. We can, nothing. Only we can say thank you. Your help is very, very, very important for these people.